This is Meisinger's Benex Control Professional Kit. It's an atraumatic root extractor. The kit contains a series of burrs for removal of the crown of the tooth or any metal obstruction that may impede the ability to get to the root of the tooth. It then has a thin and thick drill, as well as some 700 and 700 XXL burrs, and some long thin diamonds to use in place of a periotome, if a periotome is not the instrument of choice. Then has short and long anchors in both thick and thin. There's also a small quadrant tray that can be used if you're concerned about the integrity of the adjacent teeth, or if you have an open-ended situation. You can put a little blue mousse impression material in there and rest the handle on top of the quadrant tray, then giving the adjacent teeth a little extra cushioning or stabilizing it in the open-ended situation. Once the crown of the tooth has been removed, we're going to take, in this case, the thin drill. We're going to insert it into the handpiece. We take the drill into the root of the tooth. As we were using the thin drill, we'll then choose either the thin short or the thin long anchor. In this case, we'll use the thin short. And we also have a short or long screwdriver. Screwdriver is attached to the anchor, and the anchor then is screwed into the hole we've just placed into the root of that tooth. Once it's screwed in nice and tightly, we're going to leave it behind. After the anchor is placed, you're going to take a periotome and you're going to release the periodontal fibers. The handle then will rest on the adjacent teeth and rotates depending on where you're at in the mouth. The cable is then attached to the tooth, and a sleeve slides over to hold the two pieces together. The cable is then inserted into the handle, and the handle is then turned to put pressure on the cable. As it's rotating, you'll start feeling it tighter and tighter and tighter as it's stretching the PDL. When it gets tight, just let it rest. You let it rest for about 30 seconds. Again, we're just stretching the periodontal ligament. One of the biggest mistakes when using the Benex is we try and rush it too quickly. We're just going to let it rest, and again, take our time. Give it a few more twists and turns, and you'll just start seeing it being stretched. Again, when it gets tight, let it rest. And eventually that PDL just gives up, and out comes the tooth. The beauty of this is when it comes out, you have beautiful soft tissue intact, hard tissue intact. Again, when we're against a very thin buccal plate, it's imperative, as what we call, like in the Sexy 6, to use this so we can keep both the soft and hard tissue perfectly intact. After that, you can decorticate the lamina dura, place an immediate implant, or graft and come back and place an implant at a later date.